Good afternoon.
Good afternoon.
One more time. Good afternoon.
Good afternoon.
Thank you so much for joining us today. I was talking to Shannon Andrews, and she was saying, this feels like a high school reunion. I'm very grateful to all of you for joining us today for this celebration. This is an incredible milestone, the 30th anniversary of the reopening of Provident Hospital, which is now part of Cook County Health. I'm honored. That's okay, you can applaud, that's good. I'm honored to see so many of you. If I could have your attention, please. I'm honored to see so many of you who've played a critical role in this remarkable journey. Actually, 30 years ago, I was alderman of the 4th Ward, and I was here as part of the celebration of opening this facility. So this is home. As we start our celebration, I'd like to recognize a number of the folks who are here today. Commissioner Bill Lowry, whose district includes Provident Hospital. Now, I'm going to save a little time and ask you to hold your applause until I finish with the entire list. How's that? And then you can have a great round of applause. All right. Representative Mary Flowers, would you stand, please? We got 2 members of the board, 3 members of the board of directors of Cook County Health. Otis Story, Robert Curry, and Joseph Harrington, and a former CCH board member, Mary Guggenheim. Cook County Health CEO, Israel Rocha. Members of the Sengstack family, Mark and Dr. Amelia Sengstack, and Maidi Sengstack. The Provident Women's Auxiliary, and Bill Quinlan, who serves on our Cook County Health Foundation board and is representing one of my predecessors who helped grow the Bureau of Health, his uncle, Dick Phelan. Please give them all a round of applause. "30 years ago, the Cook County Board of Commissioners reopened this historic institution on the south side of Chicago. Since that day, we've grown together, weathered challenges such as the pandemic that brought our world to a standstill, experienced triumphs, all while upholding our mission to provide quality health care for everyone. When Daniel Hale Williams founded Provident Hospital in 1891, he established this institution as a place where people of color could receive high-quality medical care and training at a time when other hospitals would turn us away. Over the past 30 years, Provident Hospital has evolved into a beacon of hope and a pillar of strength for the diverse communities we serve. Looking around this room, I see many faces that have been part of this journey. Physicians, nurses, technicians, administrative staff, volunteers, all of you, thank you. Each of you plays a critical role in making Provident what it is today. Now, I know that there are people in this room who've been here for 30 years, and I want you to stand so we can all applaud you. Today, we celebrate the enduring support of our local community. We know that Provident Hospital closed as a private institution in 1987, but with support of local residents, including John Sengstack, they worked and lobbied to have the hospital reopen. We're grateful to all of you. Last week, some of you may have been with us, as we recognized the Provident Scholarship Fund. We awarded $1 million in scholarships to future healthcare leaders who are from and committed to caring for underserved communities. This is one way Cook County government, Cook County Health, and the Cook County Health Foundation are collaborating to further health equity and access. These scholars are the next generation of healthcare leaders and will carry on the Provident tradition. Provident Hospital is a testament to human resilience and an emblem of community strength. We're an institution grounded in compassion, in care, and in the belief that everyone, regardless of their race, their socioeconomic status, their immigration status, deserves access to quality health care. As we look back over 30 years, we also have to look forward. We envision a future where Provident Hospital continues to break barriers, foster a healthy, thriving community. We'll continue to provide excellence in service and care for our community. Now, there are a number of speakers who are joined us today. I ask that you give them your attention. I'm going to begin by introducing Commissioner Bill Lowry. The hospital is in his district, and I would ask that each subsequent speaker introduce the person who follows them. Thank you so much.
First of all, I'd like to say thank you, Madam President, for your exemplary leadership, your service to the entirety of Cook County, but you serve without ever forgetting the communities that we're surrounded by, which have been the recipients of disinvestment for years and years and years. We thank you. I am Bill Lowry. I'm Cook County Commissioner of the 3rd District. Welcome to the 3rd District. Provident Hospital has been a staple for residents of the South Side of Chicago since Dr. Daniel Hale Williams opened the hospital in 1891. Since then, Provident has been the site of service and generational change, as it was here where the first nursing school for Black women in Chicago was opened. And it was here where the nation's first successful open-heart surgery was performed. And since 1993, Provident has been an affiliate of Cook County Health. For me, Provident is truly one of the gems of the 3rd District. Over the past several years, Provident has cut the ribbon on a new dialysis center, cut the ribbon on a new MRI center. Last fall, Provident resumed ambulance access, thus impacting thousands of lives. And for the past 2 years, Provident has conducted the scholarship initiative, which the President referenced. Last year, over $500,000 were awarded in scholarship dollars. As you just heard, this year, we have surpassed $1 million in scholarship dollars. This is the type of investment in healthcare. But while it's an investment in healthcare, it's also an investment in our community, and it's an investment in our youth. Still to come is the reimagining of Provident, a multi-million-dollar investment in the hospital itself. To all of you who have made the 30th anniversary possible, I say thank you. I say thank you on behalf of the South Side of Chicago. I say thank you on behalf of the 3rd District, and I say thank you on behalf of Cook County. To all of you, be safe and be blessed. I'll see you soon. First of all, I got an F for applauding after the President said, hold your applause. Now I'm doubling down because I didn't introduce the next speaker, who is my dear friend Israel Rocha, CEO, Cook County Health.
Good afternoon, everybody.
Good afternoon.
We're so happy to be here. We welcome all of you to celebrate the 30th anniversary of Provident Hospital joining the Cook County Health family. I would like to thank our Cook County Board President, Tony Preckwinkle. She has been an essential advocate in helping our efforts grow and modernize the Provident campus, and I'm grateful for her dedication to increasing access to care on the city's south side. I would also like to just recognize, they were introduced previously, our commissioners and our board of directors who are essential partners in what we do, continuing to advocate for us to be able to get the resources to support our team and to support a broad and ever-expanding vision for Provident Hospital, as well as our aldermen and our city representatives who are here with us, and of course our 3 board directors who are with us here today, and our former board of directors who are with us today that was all introduced earlier. We also have a few special guests here today, the Singsack family. We have Vila, Mighty, and Mark and Helen who are here, who carry on the advocacy of John Singsack, a remarkable civil rights advocate and publisher who led the charge to reopen Provident Hospital. Thank you and welcome again. Bill Quinlan, who is a member of our Cook County Health Foundation Board, also represents as a past board president, Dick Phelan, who helped to lead the acquisition of Provident Hospital by Cook County. Welcome. And Lewis Holland, who also serves as a Provident Auxiliary Board with a rich history of supporting the hospital, its patients, and helping to continue the legacy of the hospital's founders. But most of all, I want to thank all of those here today from Provident Hospital, our staff. I've always said that a hospital is simply bricks and mortar. It is our hospital building is bricks and mortar. What makes it a hospital, what makes it a place of healing, what makes it come to life is all of you and each and every one of you who help make Provident a true place of healing. So congratulations and thank you to all of you for your dedication and excellence. Yes, you can applaud. It is your faces that our patients see when they come in scared, when they come in frightened, when they have to hear bad news or celebrate amazing welcoming of new family members or the healing of a family member. You are the people that they remember. You are the ones that make them get through it. So thank you for what you do. I also want to congratulate all of you on your exceptional careers from the bottom of my heart for everything that you do to keep making things possible and to keep helping Provident grow. It's hard to believe that 30 years have passed since Provident has reopened and been part of the Cook County Health Program. Provident Hospital has a proud history of providing quality care to residents of the South Side. Today, as an affiliate of Cook County Health, Provident Hospital continues to stand as a symbol of commitment for health equity and for the residents of Cook County in a mission to care for everyone. To keep our lasting impact in the community has always been here is our staff who helps remain the mission-driven programs that our hospital founders envisioned. And through challenging circumstances, global pandemics, we continue to charge forward in delivering a health model that will not fail because of the work of everyone here today. It is with your dedication that we are here, and it is with your hard work and investments that Provident Hospital flourishes. We also want to thank and support the Cook County Board of Commissioners and our own Board of Directors who have been here to to ensure that these enhancements happen, who have been able to help us to restart ambulance runs, who've upgraded our equipment, and who are ensuring that we are able to be here so that we provide the right care at the right time and the right place to our patients. Provident Hospital is the cornerstone of our system. Over the past few years, we have invested more than $9 million in expanding and modernizing the Provident campus. What has that led to? Because we hear the amount, but you really want to see, and I always say, it's the service that our community wants. And so that has meant that we have been able to expand the number of beds from 10 to 38. We have been able to reimagine and renovate our emergency department by welcoming back ambulance runs and enhancing our capacity to heal. We have reopened our intensive care unit here at Provident Hospital. We've opened an outpatient dialysis center here at Provident Hospital. We're installing new radiology equipment, including a new MRI and 3D mammography unit here at Provident Hospital. And every day, we are actually adding more capacity, adding services, adding surgical subspecialties, dermatology, neurology, and gastroenterology. And today, we can say that Provident is at some of the highest points it's been for our inpatient census, for the number of surgeries performed, and most importantly, for the number of people cared right here in their home at Provident Hospital. This is just the start of the work that we're doing to revitalize Provident. We are committed to building on a legacy that the institution was founded on by Dr. Williams to ensure that the hospital thrives and is here for generations to come. Just this past month, Provident was recognized as one of the nation's great community hospitals by Becker's Hospital Review publication. As I look around the room, it is clear that that award is much deserved. I am grateful for the support that everyone has been able to put forward, for the amazing work and magic you bring to our hospital to make it possible that people get healing care and treatment at the time and place that they need it. And while there are really no amount of words that we can say, what we're really here to say on behalf of the system is thank you to each and every one of you, to our staff, to our patients, and I've always said that we need the community support or we would be nothing. So to everyone in the room, our elected officials, our leaders, our patients, our community, and our staff, thank you for helping make Provident an ever-growing and ever-strengthening hospital to be here for our community. I would like to say a few words in Spanish. Gracias a todos los que están aquí para acompañar a hoy para celebrar el tragísimo aniversario del Hospital de Provident. Hoy, como afiliado del Cook County Health, el Hospital Provident continúa siguiendo un siglo de compromiso con la equidad y la salud para los residentes del condado de Cook y nuestra misión para brindar cuidado médico a cada todos, independientemente de su estatus migratorio o capacidad de pago. Seguimos invirtiendo en el sistema de salud a nuestro personal, a nuestras instalaciones y a nuestra tecnología para poder brindar un cuidado a primer nivel. On behalf of all of the Cook County Health family, congratulations. Happy 30th birthday as being part of our system, though we know it's been here a lot longer. We're just so pleased that we can have this partnership that ensures that this hospital is ever growing and ever present. And with that, I'm very, very happy to bring forward the Provident Hospital leader, our Chief Hospital Executive, Dr. Arnold Turner. Thank you.
Good afternoon. Thank you all for being here today to celebrate such a huge milestone for Provident Hospital. As the Chief Hospital Executive for Provident, I feel incredibly proud of the work we accomplish together every day. Provident holds the distinction of being the first African-American owned and operated hospital in the United States. Established in 1891 by Dr. Daniel Hale Williams, a surgeon, Provident played a crucial role in serving the African-American community in Chicago, providing accessible health care services at a time when racial segregation and discrimination were prevalent. It served as a cornerstone of this community, offering medical care to those who had limited access to quality health care due to racial barriers. This healthcare institution was also a training ground for many African-American physicians, nurses, and medical professionals. By offering medical education and residency programs, Provident contributed to the professional growth and advancement of African-American healthcare providers who faced numerous obstacles in pursuing medical careers at that time. While it's been through a lot since then, Provident's legacy continues to inspire and motivate future generations of healthcare professionals. Our team works tirelessly to expand access to care right here on the South Side. And today, we thank you for being part of that effort. Thank you. And now, I want to introduce Mertie Sinstack, Defender Charities and granddaughter of John H. Sinstack.
Hello, everyone. My name is Maiti Singstack Rice. I'm president and CEO of the Chicago Defender Charities. We produce the amazing 94-year-old Bud Billiken Parade. And we will have our wonderful parade starting at 10 a.m. this Saturday. And I want to say, first of all, Provident Hospital is our family. We appreciate all of you, and I'm so amazed at how many people have been here for 30 years. I'm also happy to say I was just a baby that time when I came, but I was here at the opening. But we have pictures, and my mother tells me all the time how I was here, and my grandfather used to talk about John H. Singstag, famed publisher of the Chicago Defender. He worked tirelessly to make sure that they raised money to make sure that the hospital would be here. It meant so much to him. He would carry stacks of papers, and it was all about Provident. There was a lot of things that he accomplished in his lifetime, integrating baseball, integrating armed forces, the Postal Service, and this is through him convincing President Truman, Lyndon Johnson, Branch Rickey, who owned the baseball league at the time, so that Jackie Robinson can play. All this is documented in Library of Congress. But I think his most heartfelt accomplishment was Provident Hospital. It was near and dear to his heart, so much so that the board at the time almost named it Singstack Hospital, but he humbly said no because he cared about the legacy of Dr. Daniel Hale Williams. And that's what's so important, that you all are continuing these legacies. Legacies are so important. I also want to say how much I appreciate that Provident is a partner and collaborates with us every year and will be at the Bud Billiken Parade also. So we're grateful. We're grateful for all your hard work. We're grateful for everything that you all do. I'm grateful for President Toni Preckwinkle and her hard work. I'm grateful for Commissioner Bill Lowry, for Dr. Turner, the esteemed board, and the entire staff here, and those in our community that still support the amazing Provident Hospital. Thank you so much. Actually, if you don't mind, is it okay if my cousin, Dr. Singstack, just says one or two words? Of course. Okay. I didn't want to get in trouble with our president.
Good afternoon, everyone. I'm Mark Senstack, Executive Director of the Chicago Defender Charities. Mr. John Senstack, who led the effort to raise the money to build this facility that we're in now. He is my uncle. And my memories of Provident are dominated by the fact that, well, first of all, he was elected president of the Board of Trustees of Provident. I believe it was in the early 70s. And when he talked about Provident, he was excited. It was fun to him. It was exciting. And that rubbed off on me. And what I want everyone to understand is that the excitement that he had, the fun that he had to do something serious, that is something I think we can all take into ourselves, into our own lives, and especially to pass it on to our youth who really need our help. If all of our youth had someone, some adult to be with them, they would not be downtown tearing up the place. They'll be our next senator, CEO, president of the Cook County Board, president of the United States of America.
All right.
Ladies and gentlemen, we thank all of you for making Provident what it is today, and we invite all of you to work with all of us to keep this hospital going for another 100 years. Thank you. And next, I'd like to bring to you Lois Holland, Lois Holland, Vice President of Provident Women's Auxiliary Board.
Thank you very much. Forgive my seat because it seems that my youthful mobility is fleeting. I'm glad that I'm the last one because I wouldn't want the president to get me for not remembering who comes after me. My association with Provident Hospital is threefold. I am the vice president of the Provident Women's Auxiliary, a group that was formed by professional black women more than 30 years ago to help the hospital through volunteering and fundraising. Some of our projects have been contributing and buying furniture for the pediatric waiting room, for visiting with inpatients during the holiday seasons, giving them plants, and providing hats, gloves, scarves, simple clothing for patients who have visited our emergency room and were in need. My second level is that I am a 67-year resident of what used to be the low end, now Bronzeville. During that time, Provident has always been a beacon of hope, our safety net, and a health bedrock for this community. We've always felt safe in knowing that Provident was here. When we closed in 1987, we had some lean times, but we were happy to support and come back in 1993. The last phase is that in my 40 years in public health, I had the pleasure of working with nurses who graduated from the School of Nursing that was established in 1893. Two of those ladies are here today. And then, most importantly, as a patient, my family, my father, my sister and brothers, my daughter and my granddaughter, who is presently enrolled in the pediatric cluster here, have always received services via the emergency room or your primary health care clinics. We've always been serviced with compassion, with quality, and with professionalism, each time having a positive health outcome. So I've come today to thank you for those people who've been here 30 years. I don't know that there are any of us who've been here since 1891. But thank you. We look forward to serving with you, and we look forward to a continued healthy community through Provident. Happy anniversary, and please, all of you, take care.
All right, thank you. I ask for your patience just a little longer. Yes, Nick?
Yeah, we'll do it.
What is it that is going on in our world right now?
Just a second. We're grateful for everybody in this room, but we also want to share this moment with a broader audience, and we have reporters here who will do that for us. So I ask you to give us your attention just a little bit longer. Could you start your question again, ma'am?
Sure, and it does feel like it is like a reunion here. So I do want to talk to some of these folks who haven't seen each other for a long time.
All right, they'll find you at the end of this, okay?
Especially the nursing students, right? Did you mention? Yes. Okay, don't leave. I'm Leah Hook with Channel 7. Thanks for taking a couple questions. The significance of the timing of this. What is it that's going on in our world right now and in our city with folks still struggling after the pandemic? We have new arrivals coming. What is it that's going on in our environment right now that makes having a healthcare facility like this so significant?
Well, first of all, let me just say, 30 years ago when I was here as alderman of the city of Chicago, it was a moment of relief and celebration that the hospital was reopening, because in 1987 it just abruptly closed its doors. And between 1987 and 1993, clearly the services here at the hospital were unavailable to the community. So we were very grateful in 1993 to be part of the reopening celebration. We have recently, and I want to thank Israel Rocha and Dr. Turner, we've recently invested a great deal in this facility in terms of expanding services and support for the community. And I would ask Dr. Turner to come and talk a little bit about the last year or two and the services that have been added to provide better care to the people of Cook County.
And perhaps that's what we're seeing in the city right now.
In terms of what we're seeing in the city. Thank you.
Thank you. Over the past couple of years, Cook County Health has invested in over $8 million in Provident. We established a diagnostic imaging center that includes digital radiographic equipment, fluoroscopy, ultrasound, 3D mammography and nuclear medicine, CT scan, and added an MRI. Proud to say that our 3D mammography and our nuclear medicine are accredited by the American College of Radiology. We reopened the intensive care unit. We re-engineered our emergency room. We established ambulance runs. We expanded our bed capacity on our med-surg unit to 38 patients. And we're looking for more opportunities to bring new services to our community. We increased the number of ambulatory surgery cases that we performed to over 3,000, and on target this year to do over 3,500. So we're working to meet the needs of our community by addressing some of their healthcare concerns, particularly in the areas of hypertension and diabetes, by focusing the management of those care of those diseases in our clinics.
Thank you. Israel, you want to say a few words as well?
You know, what I would say that it's also really important is that We're working hard to make sure that the areas where we feel that we can make the most measurable difference, making sure that services like dialysis, which are every day and are necessary and are heavily dependent on transportation and access challenges, are here at Provident. Those are where we've been investing in. Making sure that there's an emergency department to welcome you when you have concerns. Making sure we have the services to be there when our community needs us most. And your question about the larger sense of where everything happened, I think what we saw during COVID and we saw at other times is that, as the president said, even why our scholarship fund exists, there are communities that have been underrepresented, and either underrepresented in access, underrepresented in members being part of medical staff, physicians, doctors, the community overall, and we have work to do. Provident has forever been a symbol of what is possible and what can be, and I think that what we're celebrating is the 30 years of being able to continue that vision and that work moving forward, and celebrating some great services that the Provident team and Dr. Turner and the president's support and our board have made happen for the community.
Just to kind of wrap up, I think it was quite clear during the pandemic how important healthcare institutions were, and particularly community hospitals, which are in our neighborhoods and serve our communities. And of course, Provident is one of those safety net, community serving hospitals that we're also grateful for.
I just had a question for the think tank as well. What was it that was such a personal mission for you?
Oh, I have a
Sure. Maiti?
Yes. Hello. Hi.
Introduce
Well,
yourself again, please.
okay, I'm Maiti Singh Stack Rice, soon to be Dr. Maiti Singh Stack Rice, but not medical. Thank you. Yeah, Governor State. Yes, so my grandfather would, in our family, we have these amazing stories that we share throughout the years. And he kept saying that he didn't want people to have to travel so far when there was trauma happening, and that was one of the things that were happening while they were in an ambulance. They'd have to go all the way across town, and people didn't make it, and it broke his heart. So being on the board, he was able to find out about these stories and see it firsthand, also reporting on it and having it published in the Chicago Defender. He knew that these things were happening, and it broke his heart, and that's why he worked so hard and tirelessly to raise $55 million to have the hospital back where it should be. Yes.
Can I do that?
Sure. Yeah. Go ahead.
Hello, I'm Mark Sinstack, Chicago Defender Charities. One thing I'd like to add to the question is, I'm not going to tell you how old I am, but I will say I had the opportunity to listen to Mr. John Sinstack tell me about many of the things he did in his life. I know more about the Chicago Defender newspaper as a social service institution, as a civil rights institution, as a business incubator. I know more about that from the stories that Mr. John Sinstack told me than I know about the Chicago Defender as a newspaper. Something would say to me, oh, the Chicago Defender is also a newspaper. That's how John Sinstack used the Chicago Defender. He once told me that the press is a powerful tool if you know how to use it. And he sure knew how to use the press. He also said to me one time, he said, I enjoy helping people. And ironically, that did not sink in with me at that point. But over the years, I saw the significance of that. Service, public service, was built into John Sinstack and his uncle, Robert Sinstack Abbott. And a number of things came together, and all that manifested itself in his drive to bring forward to us Provident Hospital.
Thank you. Thank you.
We have Kristen Schorch from WBZ.
All right, Kristen.
I just was wondering if you could provide a little bit more specifics on the future of Provident. What do you envision this hospital looking like in the next 1 to 3 years, and maybe short and long term?
Sure. So the question is, what do we envision Provident looking like? We're going to continue to invest in expanding services, here at Provident. We've done, as you heard from Dr. Turner, a lot of work in the last couple of years, $8 million in investments. Let me bring Israel back to the podium, talk a little bit about what we're considering. I want to say, too, that we have engaged a consultant to look at the present services we're providing and what the needs are in the community to try to figure out, in a longer term, how we're going forward. Israel?
So, what I would say is that Provident is growing. It's grown, and the most important and pressing thing that we can do is to bring services here faster as quickly as we can. And that's why we've really worked on making sure that we've started the intensive care unit, we expanded medical surgical capacity, ambulance, dialysis, others. Where we're going in the very near future, and Dr. Turner is always working to advocate to bring even more services, is that we're going to continue to bring more specialty care. So one of the reasons why patients right now, and a good portion of patients in the South Side, have to leave the South Side is because they don't have the specialist. And while there may be some hospitals here, we want to make sure that they're strong and that we have even more hospitalists available, because when we monitor patient trends, there's still a lot of people who are going north for their care. And so we're looking at what are those areas step by step and trying to bring those services here. So we've expanded surgical capacity. So we said we went from, about 1,800 to now we're on track to be at about 3,500, doubling that capacity. That means people don't have to go anymore. Bringing more specialists, looking at GI, looking at endocrinology, expanding our specialty care, expanding what we do in cardiology, and making sure that every day we're creating some way that people can stay here and get the care that they deserve. What we have invested in looking at from a physical plan perspective is where we're going to go in the future. What would the Providence campus look like? What do we need to build to make sure that not only are we bringing the services, which are first and foremost, but that we're also making sure that the building, the capacity, the structure is there to foster it into the future. And that's what we're working on, to make sure that we accommodate the right resources. But the most important thing for us is to get the services right. And so what we're working on right now and what we're building immediate short-term, more specialty care, more access, more availability. Long-term is going to be what is the housing structure to make sure that we have state-of-the-art availability to house those services here into the future. And the goal is always to make sure that as many patients as possible can receive their care here in the community and live to our goal of care, which is right care, right time, right place, and making sure that that happens here for patients on the South Side.
Zoe, do you have any questions? Okay.
All right, I think we're good. We're going to take a quick group photo, and then I think we're going to cut a cake.
All right. I want to thank all of you for your patience, and more than that, for the good work you've done on behalf of Provident and the people of Cook County. Thank you.